What are Hounsfield units? Who in lung cancer court scans? Imagine a scale that helps doctors understand what kind of tissue they are looking at inside the lungs. That's what Hounsfield units are for. They are a way to measure how dense or how much a tissue blocks X-ray beams during a court scan. Each tiny part of the scan, called a voxel, gets a number based on how much it slows down or absorbs the X-ray. These numbers help tell us what kind of tissue is present. Water is used as a baseline and is assigned a value of 0 Hu. Air, which is very light and doesn't block X-rays much, has a value of about -1,000 Hu. Dense bones can have values over 1,000 Hu because they block a lot of X-ray beams. Soft tissues like muscles, organs, or tumors fall somewhere in between. In lung cancer scans, these Hu values are very useful. Normal lung tissue, because it contains a lot of air, usually has Hu values between -900 and -500. When doctors see a lung nodule or lesion, they look at the Hu values to help figure out what it might be. Malignant tumors tend to have higher Hu values than normal lung tissue because they are denser. For example, a cancerous lung nodule might have an average Hu between 30 and 50, with maximum values less than 150. Benign nodules often have Hu values outside these ranges, which helps doctors distinguish between benign and malignant growths without needing invasive procedures. To get these measurements, radiologists place a small circle called a region of interest on the court image within the lesion. They then calculate the average, minimum, and maximum Hu values in that area. This detailed analysis can be part of more advanced techniques like histogram or texture analysis, which give even more information about the tissue. Using Hounsfield units in lung cancer court scans provides a precise way to understand tissue density. It helps doctors differentiate between benign and malignant lesions, supports diagnosis and staging, and even helps monitor how well a treatment is working. This numerical approach enhances accuracy and can sometimes reduce the need for invasive biopsies. Remember, though, that these measurements are just one piece of the puzzle. Every patient is different, and medical decisions should always be made in consultation with healthcare professionals who can interpret these numbers in the context of the whole clinical picture.